You are watching the Doctalk show.
The latest in the world of HIV are new treatment modalities such as PrEP and PEP. In case you don't know the difference between these two, PrEP means you take in ARVs when you're HIV negative to prevent you from getting the virus. PEP means you have been exposed to the virus and you take ARVs as a way to prevent you from catching the virus. So there are some questions around PrEP and PEP. Those are two very confusing topics. So I want to clarify some of the issues surrounding that. I'll start with you, Dr. Fiona. PrEP is a fairly new treatment approach, and people may not be sure how long should one take PrEP, what should they do when they're on PrEP. Maybe you could clarify on those ideas.
PrEP, pre-exposure prophylaxis, is something that you take as a planned prevention measure. So you might be on it for several months or several years, depends how long you're at risk. So if you are having multiple sexual partners, then you would stay on PrEP during that whole period. The point where you're no longer at risk, maybe settled into a relationship with somebody who's HIV negative, then it may no longer be necessary to take PrEP. Okay. But it's basically to protect you during a period of risk in your life.
So it can be started and stopped.
Yes, yeah. So it's only effective if it's taken regularly. So you need to be taking at least sort of 4 or 5 tablets in a week for it to be effective. And the other thing to note is that it doesn't protect from other sexually transmitted infections. So things like chlamydia, gonorrhea, syphilis will not be prevented by PrEP, and therefore it's still advisable to use condoms, etc., with new partners. There are other exciting advances in the field of PrEP. So nowadays, injectable pre-exposure prophylaxis. So this is a once monthly injection, and that can provide then protection for the whole month against HIV.
Is it available in Uganda?
Currently, it's only available as part of clinical trials, but if it is proven to be very effective, then in years to come, it might be more widely available.
Okay. And there are also reports that the ARVs will also be available, not just in PrEP, but people who are positive for the virus, that the treatments will soon be available in monthly doses or 3-month doses. How true is that rumor?
Yeah, so the field of HIV treatment is also evolving rapidly. So long-acting antiretrovirals. So you may in future not have to take a tablet every day, and this could be long-acting tablets or indeed injections or implants. Those things are all still in the phase of research at the moment, but in years to come, there will be different ways of treating HIV, which may be easier for people to live with.
Okay, that's excellent. So I look forward to these new advances coming soon, very soon. So Mr. Kasabante, in your professional practice, you must have had several myths and misconceptions around HIV. Could you help demystify some of these myths you've had?
I've had people that your results will be negative if you swallow garlic the day before. If someone is on PEP, they'll go and test and they'll be negative. Lots of things regarding HIV testing exist. But the truth is that when you want to get into a sexual relationship with someone, the best way to identify whether the person is HIV positive or negative is when you go do a test and repeat that test either after a month to rule out whether it is in the infectious window, but the best moment will be when you repeat 3 months after the initial test, as long as you stayed faithful to one another. That's when you can purely confirm that this person is HIV positive or negative. The other myths regarding which I've had people talk about swallowing some tablets so that the virus disappears, or eating certain foods and your CD4 count raises. The only thing that can help you raise your CD4 count as an HIV positive person is when you adherently swallow your medication. You take your ARVs as per the prescription of the doctors. If it is twice daily, you take twice daily. If it's once daily, you take once daily without missing any tablet. That's very important.
And that will help build someone's CD4 and help them get a healthier life.
Yes.
All right. So how about there are these rumors around lumbar punctures? Earlier in the discussion, we talked about diagnosing meningitis and they have to remove water in the back. Most people think that this test will cure the patients. How true is that?
So in a week, also our team does around 20 plus lumbar punctures. And for the last many years, we've never had a patient die due to a lumbar puncture being performed, because before we undertake any lumbar puncture being performed, we assess whether this patient will benefit from the procedure. We won't say that it's the safest procedure on earth, because as any procedure, you have to weigh benefits versus the risks. But these procedures, when they are performed by a team of trained doctors, it's very safe. We take off fluid from the back, we assess it, then we identify what exactly is causing these symptoms in these patients. We may do a lumbar puncture when we are thinking that, yeah, you know, this could be TB meningitis or this could be cryptococcal. But even if we do it and it turns out negative for both, it gives us an idea about something else which can cause meningitis in these patients. Okay. So it's important that people shouldn't be fearing. After all, it's the same procedure that mothers undergo when they are going to deliver by cesarean section.
Yeah. So as a wrap up, the final messages, Dr. Fiona, any key message you want to tell the public on prevention, here?
HIV is a completely treatable condition. At the moment, it's not curable, but it can be treated and managed, and people can have a normal life expectancy and lead a very healthy life. And we hope that this will reduce stigma around HIV, because it is a stigma which is killing people at the moment, stopping people testing, stopping people engaging with care. So the key is to test early and take treatment early. Second important message is that nowadays diagnostics and treatments for AIDS defining conditions are much better. We can diagnose TB from a urine test and cryptococcal from just a finger prick blood test. And the treatments are getting better. So AIDS is no longer a death sentence. Even if you have AIDS, you can get better and you can get back to full health.
When you mean AIDS, what do you mean?
So yeah, so if you've had HIV for many years and the body has become very weak, you've lost weight, you have fevers, you end up in hospital. It used to be called Slim's disease. That is no longer a death sentence. You can get a proper diagnosis, get good treatment, and now get back to normal health.
So, Dr. Kaspant, any last words? Key words and key messages?
Yeah, so my key message will go to anyone out there who has not got an HIV test in the last 3 months, to be informed that it's important, especially for you as an individual. If we are all going to hit the targets of the 90-90, we should all get to know our HIV status. And for those people who already know that they have HIV, it's important to go to a hospital so that you can be tested for some of these infections before you think of starting yourself on medication. I know many people, and we've treated many people who come in with what we call iris in medicine, whereby they've started medicines themselves because they've started feeling very weak, and these medicines are now making them feel bad. And they are actually part of the reasons that's why people say when you start HIV medication, you die. It's simply because people are starting some of these drugs when they are at the terminal end of when they are in advanced HIV disease stage with AIDS, and all these infections have come in. So when their immunity improves slightly, it just takes them off balance.
So in other words, just saying those who take medicines without the supervision of a doctor land into problems.
Yes, that's very important to note.
Okay.
And also for those who haven't, who have been off their medications, before they restart them, they should visit a health center and they are helped to restart or to be switched.
Okay, and finally, expectant mothers, what for them if they are HIV positive? Do they take ARVs won't the ARVs affect their baby?
No, if you're an expectant mother who is not on treatment, then it's really important to get on treatment tomorrow, because if you can have undetectable viral load by the time you deliver, then the chance of your baby being HIV positive can be less than 1%. Yet if you remain untreated, it can be as high as 30%, so 1 in 3. So being on antiretroviral therapy in pregnancy is absolutely critical to give you a healthy baby. And yeah, these drugs are safe in pregnancy. And
safe in pregnancy, so they won't affect the baby in any way?
No. No, what affects the baby is being exposed to HIV in utero or during the delivery and during breastfeeding. So getting undetectable means that you can breastfeed safely and you can have a safe delivery.
All right, so undetectable means non-untransmissible. So that essentially means if you living with HIV and you take your medicines well and you achieve a non-detectable viral load, meaning that the viral particles circulating in your body have been reduced to the bare minimum, that means your risk of transmitting the HIV to someone else will be greatly reduced. And it applies to all individuals, whether it is man or woman, pregnant lady, whichever. If you have a non-detectable viral load, that means you cannot transmit the HIV to someone else. So the goal is to make sure everyone knows their status, you know what your HIV status is. If you are positive, you have to start treatment as soon as possible. And there are safer drugs in the market. Research has shown the drugs are very safe and effective with minimal side effects. And after starting the ARVs, you'll be put through a monitoring phase to see how you're doing with your virus. We aim for the virus being undetected. If it is detected in your blood, you might you increase the risk of transmitting the virus to someone else, especially if you do not use appropriate prevention methods such as condoms or other methods. So I want to thank you very much, our doctors, Dr. Fiona and Dr. Kasvante from the Infectious Disease Institute, to tell us, taking us through HIV discussion, and also to our guest, our special guest, Mr. Justus Tugume, who told us his story much earlier in the show, told us his story of living with HIV. So we'll see you next time on the Doctalk Show. Remember to send in your questions and comments on our social media platforms. Goodbye for now.